Today, we're diving into a fascinating medical condition called Bartter Syndrome. It's a rare genetic disorder that seriously flips our whole understanding of how kidneys are supposed to work. So let's get right into it. Okay, I want you to imagine a medical puzzle. Your body is just constantly losing huge amounts of salt and water. Now, everything we know says that should make your blood pressure crash, right? But what if it didn't? What if it stayed stubbornly normal or maybe even a little low? Well, that is the central mystery of Bartter syndrome, and it's exactly what we're going to unravel today. So here's our roadmap. We're going to start with that salty paradox. Then we'll look at the kidney's broken pump to see what's going on mechanically. After that, we'll explore the 5 different genetic types, follow the symptoms from birth to adulthood, and finally, we'll cover how doctors diagnose and manage this thing. All right, let's kick things off with that core mystery, a body that seems to be completely at odds with itself. So at its most basic level, Bartter syndrome is an inherited kidney problem. Think of it like the kidneys get the wrong instruction manual from the very beginning, and they just fail to hold on to salt. This one single error then kicks off this whole cascade of really serious electrolyte and fluid imbalances all through the body. And when we say this is rare, we really mean it. The annual incidence is estimated to be just 1.2 cases for every million people. That rarity makes it a huge challenge to diagnose, and it also means that for patients and their families, just finding good information and support can be a real struggle. To really get what's happening in Bartter syndrome, we have to zoom way in. We're talking deep inside the super intricate plumbing of the kidney to find the exact piece of machinery that's failing. You can really just think of it like this. In a very specific part of your kidney, there are these tiny molecular pumps that are supposed to be constantly recycling salt. In Bartter syndrome, a genetic hiccup basically breaks that pump. It's really as simple and as profound as that. And this broken pump creates this crazy 3-step chain reaction. First, a transporter. Its technical name is the NAK2Cl cotransporter. It just fails. It can't pull salt back in. Because of that, the body starts losing massive amounts of salt and water, which leads to dehydration. And then the body basically panics. It hits the big red button and activates its emergency system, the renin-angiotensin-aldosterone system. But this overreaction just makes everything worse because it causes the body to waste even more potassium. It's a total vicious cycle. Now, it turns out that Bartter syndrome isn't just one single thing. It's more like a family of related disorders. They're all caused by glitches in different genes, but they all lead to that same broken pump we were just talking about. This chart breaks it down perfectly. You've got 5 main types. You can see types 1 and 2 are usually the most severe, and they often show up before baby is even born. Type 3 is what they call the classic form, and it's typically a bit milder. Now, type 4 is really unique because it's also linked to hearing loss. And type 5 is different yet again. It shows up later in life and is passed down dominantly, while the others are all recessive. Okay, so we've got the genetics down, but let's look at the human side of this. How does this condition actually play out in someone's life from day one? Well, the journey often begins before birth. The very first clue is something called polyhydramnios. That's just excess amniotic fluid because the fetus is urinating way too much. Then, as newborns, these babies can face life-threatening dehydration. Through childhood, that constant electrolyte chaos leads to things like growth delays and these really intense salt cravings. And by adulthood, this all tends to settle into a pattern of just chronic weakness and a thirst that never, ever goes away. And for folks with that classic type 3 form, the day-to-day symptoms are just relentless. I mean, imagine constant muscle weakness, a thirst you can never quench, and this overwhelming craving for salty foods. On top of that, it can cause growth problems, vomiting, and constipation. It makes just getting through a normal day a huge challenge. So, with such a complex mix of symptoms, how do doctors even begin to pinpoint a disease this rare? And, more importantly, how do they help people manage it? The diagnosis usually starts with a blood test that shows a very specific, very strange pattern. Really low potassium, a high blood pH, and then sky-high levels of hormones like renin and aldosterone. And here we are right back at our paradox. All of this is happening while the patient's blood pressure is totally normal or even low. That specific combination is the dead giveaway. But there's a little complication. There's another rare kidney disorder called Gitelman Syndrome that looks almost identical on paper. So the question is, how do doctors tell the two apart? The difference really comes down to a few key details. Bartter syndrome happens in a part of the kidney called the loop of Henle, while Gitelman affects a different part, the distal tubule. But the crucial test is urinary calcium. In Barter's, it's higher normal, but in Gitelman's, it's low. That, plus the fact that Barter's usually shows up much earlier in life, helps doctors make the right call. Now, when it comes to treatment, this is where things get really wild and completely counterintuitive. Patients are basically prescribed the exact opposite of what you tell almost anyone else with a kidney problem. The foundation of their treatment is a high-salt, high-potassium diet, plus some medications that help the kidneys hang on to that salt. It is a lifelong commitment to constantly replacing what the body just can't hold on to by itself. So finally, what does the future look like for someone diagnosed with Bartter syndrome? What's the long-term outlook here? Well, even with really careful management, the condition can leave its mark. This chart shows a pretty sobering statistic from a big study. 41% of patients ended up with short stature. It's a direct result of the body's constant struggle to grow properly while it's in that state of electrolyte turmoil. And while kidney function often stays okay, it's not a guarantee. About 11% of patients might end up developing chronic kidney disease over time, and that just highlights why constant, lifelong monitoring and care are so absolutely critical. So I think the key takeaway here is really one of balance. With dedicated, lifelong care, the prognosis for many patients is actually good. They can live full, happy lives. But, and this is a big but, we cannot understate the burden of that treatment. The constant medications, the special diet, the endless doctor visits. It's a huge daily challenge. And all of this really leaves us with one final thought. Bartter syndrome is an invisible illness. You can't look at someone and see their electrolyte imbalance or their broken cellular pumps. So the real question becomes, how can we as a society better support patients whose entire lives are defined by managing this relentless, invisible battle every single day?